Okay, now I'm going to talk to you about the rat. My name is Whitney Mowbray, and with this rat, I work at a small animal hospital, so we do not have a lab clinical type of research setting. So I printed off some pictures to show you of what their environment would look like in the research setting. They would have cages that has soft absorbent bedding in there, and they have water. Supply of water, and the water a lot of times is measured per day, depending especially on the type of experiments you're doing. If you're experimenting a drug that you have to measure the water and feed consumption, you definitely keep a close eye on that. As far as food goes, a lot of times they use commercial rat chow, rat and mouse feed. It has about 20 to 25% protein, about 4% fat. You measure it when you put it in there, and then you measure it when you change it out. Rats typically eat small, continuous meals throughout the day. And you also want to make sure in the lab type setting that it's kept at a relative temperature and relative humidity for the rat. And those are just some of the different things that you pay attention to in the research setting and handling these animals. I am wearing, when I work with the animals, in the lab setting, you want to prevent the spread of infectious diseases. So in your lab suite, a lot of times you have two doors, one leading in and then one going out. You want to make sure that you always go out the outdoor. And what I'll do is on the outside of the lab setting, I have my scrubs on, but then I put my gown over top of it that's been laundered, and then I put my gloves on. When I exit, go out the door, I'll strip my gown off and I'll strip my clothes. Okay, we have our little rat here, and we're going to show you how to sext him or her. And how you do that is they don't typically like to be scrubbed, but you kind of have to flip them over to look at his urogenital area. And so I'm just going to flip them over. And this one is actually a little girl. There's a shorter distance between her urogenital area. This little girl, all rats are polyestrous. With their reproduction cycle, the estrus typically lasts for 4 to 5 days. That's why in a lab setting they're awesome to be used, because you can breed them pretty darn easily and have a big population easily. Okay, next we're going to do our physical exam of her. Do her coloring. She is a black and white kind of hooded rat. She is a girl. I'm kind of looking at her just to make sure I don't see any huge abnormalities. She's a little wet because she kind of peed on herself while we were drawing her blood sample. But looking at her eyes, everything looks normal. Her ears all look normal. She doesn't have any hair loss or any lesions on her. Her tail is perfectly normal. She's walking around fine. It's not like she has any neurological issues. I'm going to put her on our little scale here. Our scale kind of weighs in ounces, kind of get her a little bit more towards the middle. And she's about 4 ounces. I could listen to her heart. I do have the pediatric stethoscope, but it would probably be extremely loud, and she's kind of wiggly, so I'm not going to do that right now. Their heartbeat is anywhere between kind of like 350, 450 beats per minute, so extremely rapid compared to ours or compared to dogs and cats. But that's basically all of the physical exam. She definitely seems very healthy. Other parts of the physical exam might, in her cage might include, is she eating and drinking, those types of things, but she's cleaning her little paws off. She's a very sweet little girl. All right. Okay, on this little girl, I'm going to show you how to do 2 types of injections, a sub-Q and an intraperitoneal injection. We're going to start by doing the sub-Q injection, placing her. The only problem with her is she really does like to be held, but I'm going to place her down and I'm going to scrub her, and she does not need any type of medication or injections, so This is strictly just sterile water that I drew up in a sterile tuberculin syringe that has a 24 gauge needle in it. And when I insert the needle, I'm going to make sure that I do not go through her skin. And I'm going to aspirate first just to make sure I don't get any fluid back. And then I'm going to advance my plunger and inject her with the sterile water. Okay. All right. Aspirating, don't see anything. I'm going to give my injection, making sure I'm not going through on the other side. All right, and then I'm going to quickly pull out, advance out, and then recap my syringe and then dispose of it in the sharps container. Next, we're going to do the intraperitoneal injection. This injection is a little bit more difficult because you're actually injecting it into the abdomen. We're going to do sterile water again. And so what I'm going to do is I'm going to scrub her, flip her over on her back, insert the needle into her kind of midline abdomen at about a 30 to 45 degree angle. It's very important that I aspirate this first, aspirating to make sure I don't get any fluid. If I get a brownish, kind of greenish tinge fluid, it kind of means that I hit her intestine. So I immediately have to pull out, straight out, and then get a new needle, new drop, a new everything, and try to go in again. If I hit her bladder when I aspirate, I will get a yellowish tinge. So we're going to do that now. We're going to flip her over on her back, kind of cupping her in my hand. She's smaller. A lot of times these lab rats, she's very young, but a lot of times these lab rats are pretty large, so you kind of have to rest them more. She's urinating a little bit. It's okay, honey. So you have to rest them more, kind of closer to your body, but with her, she's very, very small, very cute. Okay, so I'm going to take my pre-syringe I already drew up with the water. Kind of, I know you hate this. Get a bit of scrub on her. Insert my needle. Advance it. I'm sorry, I know. It's okay. It's okay. Pull up, aspirate it, make sure I don't get anything in, and then advance my fluid down. And then I'm going to pull straight out. I kind of pulled straight out a little bit too early. So in that case, if this was a medication that she needed, I would advance, change my needle. It's okay. And go about that again. But now we're going to let her rest until we do our next procedure, because that was a lot for her. Medication, so we're just going to use some sterile water that I drew up in a tuberculin syringe, and I took the needle off. And even though she doesn't like to be scrubbed, this is pretty much the easiest way to do it, is by scrubbing her, kind of putting her on her back, and then inserting the syringe in her mouth and pushing the liquid on through. Okay, boo. So let's do that, and here's our little sterile water. It's okay, honey. Ooh, ooh. She says, ooh. It's okay. And this is good because part of the physical exam, I'm able to really examine her little mouth by getting this in there. Yeah, good girl. Seeing her teeth, and since she's little, her teeth are small, but rats continue to grow their whole life. That includes their bones and their teeth. So she just had little teeny teeth. Okay, and we just gave her that little water, a little bit of water. She's not really into it. That's okay. And we'll return her to her cage. I'll probably carry her over there like this. And when I get ready to put her in the cage, I'll pick her up by the base of her tail and kind of gently put her in there. But she would kind of rather be carried, because that's the kind of girl she is. Alrighty. Okay, now I'm going to show you how to draw blood from a rat. I do have it's basically an icing bag that I've attached a rubber band at the end, and it does have some air holes. That way I'm able to secure him enough to draw his blood. I have some alcohol here. I'm going to wash off his little tail. And then I'm going to take, I think with him it's going to be easiest if all we just need is his hematocrit. So I'm just going to simply take the needle and find this little thing. Go up. Once the blood starts coming, I can take it's okay, honey, the hematocrit tube and fill it up directly from my needle end. So I filled up my hematocrit tube. I'm going to take this, take a piece of dry gauze because he's going to bleed, and apply some pressure to where I got his blood sample. With the hematocrit tube, I will stick it in my little clay mold and spin it down, and that way I'm able to read off his value. And I think he's had enough of that. We'll take him out of there. Okay. All right. That way he can kind of relax out here right now. We'll kind of give him a break before I move on to the next procedure. Hello, my name is Whitney Mowbray, and today I'm going to discuss the proper lab techniques for a mouse. I work at a small animal hospital, so I do not work in a lab setting, but I did borrow a mouse from a local pet store. But I printed off some pictures to discuss the housing techniques and the various feeding and water requirements. Mice typically need between 10 to 15 grams of food per 100 gram/pound of body weight. So that's how you can calculate their daily food requirements. In a lab setting, their food is measured and it is monitored via their chart, or sometimes they just use their cage card. Their cage is typically look like this. It's a row of them, and they're sectioned off for each individual mouse. And they do have bedding in there. They have a water container that normally measures their water as well and their water consumption based on the different experiment that's being done. And they also have a cage label on their cage to properly identify which mouse, that way for the experiment, for the tracking, they can write everything down. Their cage label will typically have their name, their date of birth, their coloring, any other genetic information that's pertinent. It'll have their weight. If you need to measure their body temperature, because the experiment, it'll have different times that their body temperature was measured, their age, those types of things. Feeding wise, they typically have diets that you can find in the pet store. Based on their nutritional needs and based on the experiment being done, they might have different types of feeding requirements. It all depends on what type of experiment is being done, but typically it's just the variety of mouse nutrition. So we have our mouse here. He is a white inbred mouse, and I picked him up by grabbing his tail. We also have these nice wrapped forceps here that won't apply pressure to grab his tail when we get him out of the cage. He is a little wiggly. We're straining him. He's in my hand. He's pretty comfortable in my hand. And then other restraining techniques could be scruffing him to apply a subcutaneous injection, which I will show you, or to do it intraperitoneal, or to sex him. Okay, I have my mouse here, and I'm going to perform sexting on the mouse to determine if it's a male or a female. Mice are polyestrous, and their reproduction cycle is normally 4 to 5 days. So let's kind of flip him over and see. And he is a male. I've determined this by his urogenital distance is larger than that of a female. So on his cage card and on his identification, we'll give him a number, And we'll put that he is a male and the type of coloring he is, and if he's inbred or not, which he is. Next, we're going to perform the physical exam on the mouse. So the physical exam is determining the color, determining if there's any abnormalities that you see, any hair loss, that type of thing. Making sure that he can walk normally, that he doesn't have any neurological issues, and you can see that he does kind of walk very normally. His tail is a proper length. It doesn't look like that he has any abnormalities. When I look in his ears, he doesn't have any discharge. Look in his eyes all look normal. They're not bulging, they're a normal red color. His feet look very healthy. Overall, he looks pretty healthy. And then when I scruff him, I'm able to look at his abdomen. Everything looks normal there. So overall, he looks very, very healthy. And that's basically the physical exam. I could listen to his heart. His heartbeat, I'm sure, is racing well over 250 beats per minute. And the stethoscope that we have, even though it is a pediatric stethoscope, but it is a little big to actually place on him to hear his heart. But I could do that. So physical exam-wise, everything looks pretty normal on him. So another part of the physical exam of this mouse is to get a weight on him. We have a gram scale that we would use. And actually, this scale does pounds and ounces. So what we'll do is we'll just convert his body weight. That way we'll know about his daily feeding and watering requirements, and if any medications have to be done to him, they have to be based on each individual patient's weight. So we'll put him here on the scale. Okay, and he weighs 2 ounces. There you go, big guy. All right, and then we will return him directly to the box. Grabbing him by the tail, it was the safest way to pick him in and out of the scale. I could use these cloth forceps, just making sure that you grab close to the base to pick him up. But I feel comfortable enough that I can use my hands. All right, now I'm going to return him to his cage. Okay, next I'm going to show you how to do some injections on a mouse. This little guy's a little wiggly, so I'm just going to show you, and then I'll kind of show you what I drew up first. So I have a syringe here. It's a tuberculin syringe with a 24 gauge needle. I just drew up some sterile water in there. I have him, I'm going to do the subcutaneous injection first. I have him scruffed and kind of smushing him. Insert my needle, making sure I do not go through the skin, aspirate, and then inject the sterile water. And then return it to the cap. And that's how you do the subcutaneous injection. My next one, I'm going to show you, and I drew up all of these syringes already with a small amount of sterile water. We will flip him on his back, having a good scruff on him, and I'm going to do an IP injection. So I want to make sure that I do not inject into the intestines or into the bladder. If I do inject into the intestines or into the bladder, when I aspirate back, I'll see a yellow discharge if it's the bladder. If I hit the intestines, then it'll be kind of like a greenish brownish discharge. Okay, so I'm going to take a needle, insert in, aspirate. I don't see anything. And then insert the fluid in. And quickly pull out. And I went at about a 35 to 45 degree angle. Okay, and then I'll return those into the sharps container. And return him to where he's a lot more comfortable underneath my hand. And that's how you do 2 different types of injections. Okay. Now I'm going to show you how to perform some oral dosing of medications that you might have to give to a mouse if you're in a lab or clinical research setting. We have a tuberculin syringe here, and since this mouse doesn't need any medication, we're just going to use some water. But how you would do it is you would fill your syringe up with the appropriate amount of medication, and then scruff him, put him on his back. He's a little like, what's going on here? Doing the syringe, you would gently put it in his mouth, a little bit at a time. He's not too terribly into this. Okay. And that is how you do proper oral dosing of this little mouse here. Okay, my name is Whitney, and I'm going to talk to you about rabbits used in lab clinical settings. I work at a small animal hospital, so we do not have the lab setting, but if this little guy, I borrowed him from a little pet store, but if this little guy was in the lab and clinical setting, he would be in a cage that has some soft, absorbent, non-toxic, low allergen bedding, and he'll have his water, a little water thing that is in it. You would measure his water when you put it in there, and then measure it at the end of the day, especially if you're testing a drug that you want to see the effects on water consumption. The feed that he would be supplied is some type of all-natural type of chow, kitten diet that you could purchase at a pet store. And you always measure the feed when you put it in there and measure it when you take it out of there. A lot of times you definitely have to have identification for the rabbits. So on their cages, they will typically have a ID card that has their name, date of birth, any pertinent genetic information, if you know who the parents are, the breed of rabbit, if they have a tattoo or a microchip, those numbers, those types of things will be on the cage card. A lot of times you can track their weight, their temperature, writing it on the cage card, or if the lab setting that you work for has clinical records, those clinical records will be close to that rabbit's individual cage. And so we're going to first go over how to tell if this little guy is a male or a female based on reproductive status. And it's very close. It's very important when you restrain a rabbit. You always want to make sure he does not jump. They do have very powerful back ends, and a lot of times if they kick or if they jump, they can injure or break their back. So you want to definitely support their hind end when you move them from the cage to the table or when you're working with them on the table. So to determine his sex, we will, or her sex, we'll scrub her, kind of flip her over for him, and look down there, and I'm able to kind of push out his little penis that comes right out. And he actually does have two rather large testicles right here too. So when I'm putting a little pressure on the penis, it is able to come out a little bit. So he is a little boy. Put him back over to where he's more comfortable. And now I'm just going to kind of do my physical exam. If he was a girl, the reproduction cycle is kind of different than a lot of other animals, especially the rat and the mouse that we just did. These actually have to be induced ovulators. So if he was around a female who was ready, then that's how the female would become induced ovulation-wise. But just performing my physical exam on him, able to kind of look at him, just first, get acquainted with him, assess his hair coat and everything. I don't see any abnormalities with his hair coat, no evidence of any mites or fleas or anything like that. He doesn't have any patchiness, and he kind of wants to get right up on me because he's a sweet little guy. But look at his ears. Don't see any evidence of any waxy debris. Like I said, I did get him from a pet store, so he doesn't have any tattoos or anything right there. Kind of in his eyes, and we can use the scope which is a little hard when you're by yourself, but we can shine the light in his eyes to make sure his little pupils contract to the light, which they do. Yeah. Okay. And then we can listen to his little heartbeat. I have a pediatric stethoscope right here. And his heartbeat is racing, probably because he's very nervous. Able to assess his lung sounds, making sure I don't hear any crackles. Okay. All right. So that's basically, we already did his genitals. We looked at those. That's part of the physical exam. We can look at his little paws to make sure we don't see anything wrong with them. We did monitor him in his cage, so we do know that he doesn't have any overt neurological issues or anything like that. He was walking fine, nothing wrong as far as that area. Okay, I have this little rabbit here. I have him wrapped up in a towel to restrain him, and I'm going to show you how to do some oral medication. He doesn't need any oral medications, so we are just going to do some sterile water in a little syringe, kind of scrubbing him, holding his back in, making sure he does not kick my football, and inserting the little metal water into his little mouth. That went extremely well. And then letting him relax. All right, now I'm going to show you how to do a subcutaneous injection on this little rabbit. He does not need any medication, so what we did was we got a tuberculin syringe and filled it up with approximately 0.2 mLs of that sterile water right there. And we are going to put a little tint up of his skin. I'm right-handed, so I'm going to do it this way. Just a small little tint, making sure that I don't go through, and then I'm going to pull back and aspirate, making sure I don't see any type of fluid, and then I'm going to advance my plunger and insert the injection, making sure that no liquid's coming out the other side, which would show that I've actually gone too far. So, do that, aspirate. Oh, it's a little cold. It was a little cold for it, but that's okay. And then pull out. And that's how you give a subcutaneous. It's just a general cleanser. You want to make sure that you always use something that is certified to use in rabbits. And I just sprayed a little on this piece of dry gauze. And I'm gently going in there. If he did have a true ear infection, we would use cotton applicator tips to kind of pick at the little chunks, just making sure that we don't go too far down in there. But his ears are extremely clean. If you look at it, actually, the otoscope. Look down in there. Okay, I know. Didn't really like that too much. But as you can see, I do have him in the towel to restrain him. We would do the same thing with the left ear, and then with the type of ear medication that we use, all we do is simply take the applicator tip and squeeze some down in there, or drop the appropriate amount of drops, and then kind of massage his little ear to massage it down there. Okay, and we'll do the same thing on the other side. Okay. Okay, next I'm going to show you how to obtain an ear cytology sample from this little guy. He's a floppy-eared rabbit, so I just lift his little ears up. He doesn't like this too much, and I take my cotton applicator tip down there, roll around, get some of the discharge. This is his right ear. His left ear, I'm going to do generally the same thing. Maybe you don't like it. You know. And this was his left ear. And on the left, just to differentiate between the right and the left, I'm actually going to break the stick of the left, and then we're going to show you how to stain the ear cytology and look at it underneath the microscope. We're going to take our slide and roll out our cytology. So I always do the rolling out the right side towards the rough edge of the microscope slide, and then the broken Q-tip I know is my left, so I'll roll that out towards the other side, and I'll take my lighter and heat fix it for a few seconds, and then I'm going to stain it. We do the dip click staining method here. So we have 3 vials of stain. We'll do about 15 dips per each one. And just to save time, I did make and do the ear cytology ahead of time on the rabbit. So what I'll do is I'll just read that one, but you would do 15 dips in the number 1 solution, 15 dips in the wax, the number 2, and then 15 dips in the stain, the number 3, and then rinse it off with your water. So now we're going to actually look at this ear cytology that I labeled for this little rabbit. And going over to the microscope, turning on my light, turning it on, the light, making sure my condenser's good. I'm looking it in the lowest power first, getting it in focus, moving it to the next, getting it in focus. Okay, and I might go down to oil for this one, just because it is sometimes hard to see the little bacteria. You know, there are some bacteria in every ear, but we just don't want to make sure that we don't see an overgrowth of cocci or rods or little yeast buds. So I'm just going to do a small drop of oil, going to my highest power magnification. And on the right side, I am seeing just a very rare occasional yeast and some bacteria, but not a huge amount. I think, and I'll write down my results for the veterinarian, but I'm just seeing an occasional on both the right and the left. I'm just seeing an occasional yeast, occasional bacteria, but we'll finish scanning this and we'll see exactly which ones we see, and then we'll write down all of the notes in the medical record for the rabbit. And I'll clean my microscope off since I did use oil. Alright, now I'm going to show you how to draw a blood sample from this little rabbit right here. We're going to draw it from its ear vein, and since we don't have a tourniquet for its ear vein, a lot of times what we use is this little paper clip. So, And I have him restrained. Let me talk about that real quick. You can use a cat bag. Didn't have one of those, so I just simply, I'm using a towel, so I wrapped him up almost like a rabbit burrito. Pretty tight in here, that way he's not able to squirm around, kind of like run around, kick himself, injure, those types of things. So putting the paper clip in his little ear to occlude the vein. I've shaved a little bit of hair. I'm going to take my alcohol, and he is a pretty good guy. And then we just need a hematocrit on him. So what I'm going to do is I'm going to take my 24 gauge needle. I see my vein, so I'm going to go bevel up right where the vein is, pop through into the vein, and then I'm going to take my hematocrit tube and fill it up directly from the needle itself, since we just need such a small amount. And two, I don't think he's really going to like it that much. It's okay, honey. It's all right. So I'm actually going to put my hand here to kind of stabilize. And start my needle in, get my hematocrit tube that I have coming off with my finger. It's okay. Kind of wiggled, so we kind of pulled it out just a little bit. But I think I got enough for the blood sample. So we'll spin this down and check his hematocrit. A lot of times if you need a sample larger than that, it's always good to have two people. That way one person is able to kind of put their hand right here and put their hand on his little rump area and kind of push him into the table. That way he won't kind of wiggle away, which he just tried to do on us.